was the concern that I had about more people in Atlanta and Washington telling me what I could do for and with my patients than anybody I ever met in medical school or residency. And so to have the opportunity, to have the privilege that you've given me to be front and center at a time when our nation is debating one of the most important issues we could ever debate, and that is your health care. And it's not our nation's health care, it's your health care. You don't have to put Washington in charge to solve this problem. But the solution is not to trust the government instead of insurance companies. The solution is to trust you, to trust patients and trust Americans. Most of us have the three big ones: accessibility, you got to be able to get into the system; affordability, you need to be able to afford the coverage; and quality, we want quality care. I add three to those: responsiveness, you got to have a system that responds to people; innovation, we must not destroy the innovation in our system that's given us the highest quality of health care in the world; and choices, you got to have choices. Not done in any of the plans from the Democrat side of the aisle, not one of them is lawsuit abuse reform. Any czar, any individual in the administration that is responsible for policy, that is regulatory control of your life in certain aspects, who doesn't go through the Senate approval process, is outside the normal checks and balances of our government, and that's wrong. We are spending ourselves into oblivion. You cannot borrow and spend your way to prosperity as a nation. It is fundamentally wrong. It is morally wrong for our nation to do so. I'm here, I'm ready, I'm willing. You've got my phone numbers, the speaker's got my phone numbers. I can't wait for the call.